Good afternoon. So here we go again. To continue with our studies of brachial plexus, we would need to complete one interesting task, and I will present this in smaller, shorter chunks in order to go individually and to name them appropriately with branches that the brachial plexus yields. We'll be talking about 5 different major nerves being product of brachial plexus: musculocutaneous, median, ulnar, and of course axillary and the radial nerve. So let's get a couple of things sorted out. To start with, let's just briefly review what the brachial plexus looks like, and then we'll take a look at one of the charts which I prepared in order for you to get more kind of big picture information about these nerves before in individual videos we start individually defining and describing these nerves. So let's go to fabulous Netter's Atlas and let's confirm what we already know and use it as the backbone for what is to come next. We know that anterior primary rami of C5, C6, C7, C8, and T1 nerves are responsible to form the brachial plexus. The posterior primary rami of earlier mentioned nerves have been already diverted to go backwards and to innervate intrinsic musculature of the spine, as well as narrow patch of skin close to posterior midline. So with the anterior primary rami, with C5 and C6, they will fuse together and form the superior trunk of the brachial plexus. C7 nerve does not merge at this stage and by itself is responsible to form the middle trunk of the brachial plexus, while the remaining two, C8 and T1, form the inferior trunk. So we have 3 different trunks and they're really related one on the top of another. And this part of the brachial plexus is practically hidden by scalene muscles, and the space that exists between anterior and middle scalene is where they finally come out and we start seeing the rest of it within the axillary fossa, the armpit. Each of the 3 trunks divides into its anterior division and the posterior division. So what I just marked with a cursor are anterior divisions, and now we're going into posterior division of the superior, posterior division of the middle, and the posterior division of the inferior trunk. Obviously, all 3 posterior divisions are coming together and they would form what is called the posterior cord of the brachial plexus. Anterior divisions of the superior and middle trunk also come together and they assemble the lateral cord of the brachial plexus. Anterior division of the inferior trunk does not merge at this stage and by itself forms the medial cord of the brachial plexus. And that is the interesting part of our journey, because these 3 cords are seen on this diagram or any other diagram as being one on the top of another. Essentially, we should never think of them as going like this. Within the armpit, they are called lateral, medial, and posterior because that is how they relate to axillary artery. There is an image in the Netter's Atlas that I will show you with brachial plexus in situ in order for us to understand where is the axillary artery and medial, lateral, and the posterior cord relative to it. If we go back to the diagram that we were using, it is time for us to identify the posterior cord of the brachial plexus. Its main products are axillary nerve and the radial nerve. Of course, you already have additional 3 branches, which you can see here: the upper subscapular, thoracodorsal, and lower subscapular nerve. You realize that we talked about muscles, they are innervating. From the lateral cord, we would have musculocutaneous nerve And part of the lateral cord, together with part of the medial cord, would need to come together in order to make the median nerve. And lastly, we have last fifth major branch of the brachial plexus coming directly from the medial cord, and that is the ulnar nerve. So I hope that this review was quite useful and that we are to start seeing things a little bit more clearly. In the meantime, I would just scroll through some diagrams, apology, and try to find image which I want to show you with the brachial plexus in situ. And here is that image. I'm sorry, I can't really look in both directions. Need to see secondary computer, and here it is. It is obviously this interesting area. That is the axillary artery that will become soon the brachial artery when it crosses the border of teres major muscle. Something that looks to us like the letter N actually very directly shows musculocutaneous, median, and ulnar nerves, whereas the posterior cord is practically invisible. Invisible because it's covered with the brachial, with the axillary artery, and as such, of course, deserves to be called this name, the posterior cord. So let us take a look at the chart, which I have here instead of a whiteboard today. I hope that you would be able to see it. I couldn't really use any larger font because it would exceed dimensions of one single sheet of paper. So what I want to give you as a little bit of extra exercise for us to start is shortest possible form of identifying some of the nerves, such as name of the nerve, axillary, comes from the posterior cord, and it is having fibers from C5 and C6 nerves. Its interesting anatomy is as it runs through what is called the quadrangular space, and when we talk about axillary nerve, I will show you on the screen what quadrangular space is and where exactly it's located. Innervates deltoid and teres minor muscle, and sensory, it is interesting because it gives us loss of sensation on the lateral side of the arm, so-called the military patch sign. Then we have the radial nerve, then the musculocutaneous, then ulnar and median. So the radial nerve comes from the posterior cord, while the musculocutaneous comes from the lateral, ulnar nerve comes from medial, and the median nerve comes together while branches of lateral and medial cord are joined together. The radial nerve carries fibers C5 to T1, so is the median nerve. Musculocutaneous gets C5 to C7, and ulnar nerve carries C8 and T1. Interesting part of radial nerve anatomy is its passing posterior to the humeral body through its own groove, the spiral groove or sulcus nervi radialis. My apologies, it's written here as ulnaris, so that's typo sulcus nervi radialis. And of course, later on, when it starts innervating, the bulk of the innervation is on the posterior forearm. All 11 muscles are coming as innervated by radial nerves. Deep branch, superficial branch of a nerve remains cutaneous. And we should not forget also that while passing through arm, the radial nerve also innervates triceps brachii and the anconeus muscle. Its innervation, cutaneous, is mostly on the posterior side of the arm, but it does have a very unique patch of skin which is not overlapped by other peripheral nerves and cutaneous nerves. So we'll be talking about this also in a section about radial nerve. Finally, we have interesting scenario which is commonly related to radial nerve injury, which is called the Saturday night palsy. Few words about musculocutaneous nerve, C5, C6, C7. Interesting thing is that it pierces the coracobrachialis muscle, which makes the muscle easy to identify, but also makes the nerve easy to identify as well. Innervation of muscles is happening only on the anterior side of the arm. So we have three muscles, the coracobrachialis, biceps brachii, and the brachialis muscle. That is justifying part of its name, musculo, while the cutaneous part of the nerve actually continues further inferiorly past the elbow fossa, and it is innervating the lateral forearm, but only the skin. Therefore, that is the cutaneous part of the nerve, the musculocutaneous. Ulnar nerve is coming from medial cord, carries CAT1, and interesting anatomy that we already know would be its positioning within a medial bicipital groove, then passing through its own sulcus nervi ulnaris on the medial side of the elbow, on the medial epicondyle, also known as the funny bone. And interesting thing which saves the ulnar nerve and prevents it from being damaged as it passes superficial to the carpal tunnel, it does run through its own opening that is called canal of Guillain at the transverse carpal ligament. This nerve is not too generous when it comes to innervation of forearm muscles. We have 1.5 muscle innervated by it. That is flexor carpi ulnaris and the medial half of flexor digitorum profundus. Part of the muscle innervated by ulnar nerve produces tendons that are going into ring and little finger. While not being too busy within the forearm, the ulnar nerve really has lots of work to do within the intrinsic musculature of the hand group. It innervates practically everything minus muscles that we use the acronym LOAF that are innervated by median nerve. Interesting anatomy, interesting pathology also could come as the consequence of ulnar nerve injury. It is something that is called the claw hand deformity, and I'm just trying to fake here as much as I can what fake claw hand would look like. I hope that we will clarify it later on with section about the ulnar nerve. And finally, the median nerve, lateral and medial cords are needed, bringing C5 and T1. Nerve is found within the medial bicipital groove, but probably most interesting and most clinically relevant information is that's the nerve which runs through the carpal tunnel, and it is directly responsible for the carpal tunnel syndrome. It innervates majority of muscles of the anterior forearm, so pretty much everything minus flexor carpi ulnaris and minus medial half of flexor digitorum profundus. But within the hand, it becomes a little bit less busy. It innervates loaf muscles, and really like O, A, and F are muscles that form this massive elevation that is called the thenar eminence of the hand. Names of these muscles are abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. L, which hasn't been addressed, stands for two lateral lumbrical muscles that are within the central part of the palm. So, loaf, two lateral lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Damage done to ulnar nerve may result with something that is called the ape hand deformity. That is a little bit harder to fake than the claw hand itself, but you really have to think about what leads to this deformity. Quite massive atrophy of thenar muscles, therefore it's creating a situation where the thumb moves with more difficulties, and as a loss of opponens pollicis, essentially the thumb becomes more aligned and more positioned just like other four fingers. So this is the best I can do for now, but we will be talking about ulnar nerve in the next section. So we're going to stop here at this point, simply naming this video as a quick review of the brachial plexus and its major branches. Now, in the next 5 sections, you're going to have videos of axillary, musculocutaneous, medial, ulnar, and radial nerve. Each and every one of them will become very short video unit on its own, and some information that has been mentioned here today is going to be also repeated to enhance its importance and its value for what we need to know. Thank you for watching, and please keep listening or keep moving through playlist where you will find in the next little while, as soon as I post them on YouTube, videos about individual brachial plexus nerves. Thanks for watching, and if you haven't done it so far, please subscribe to Anatomy Made Simple by Dr. T. Thanks.